Between 1971 and 1989, the South African apartheid state subjected thousands of homosexual people to horrific aversion therapy. The primary goal of this project was to cure gays and lesbians in the military through the use of electric shock therapy, chemical castration, and even gender reassignment surgery, all done without the informed consent of those involved. In today's video, we will cover just why such treatments were carried out and the damage it caused its victims. It is perhaps helpful to briefly explain the South African apartheid state. It was a system of institutionalized racial segregation. White South Africans ruled over the majority black population, with racism as a key part of society and politics. Black South Africans were second-class citizens, denied access to education, housing, and job opportunities. As part of keeping the black population in line, the military played a key role in enforcing the apartheid state. The key feature of the apartheid state for the purposes of this video was that all white men were conscripted into the armed forces. Homosexuality has long been considered by many societies as degenerate or as a mental illness. In fact, homosexuality was once considered a personality disorder alongside the likes of schizophrenia or paranoia. Listed in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. Attempts to cure or change a person's sexuality proved ineffective, with many prominent psychologists such as Sigmund Freud asserting it was not their place to change a person's sexuality. After gay rights activists highlighted the harm done by such diagnoses, homosexuality as a disorder was eventually removed from the manual. This, however, did not stop many looking to find ways to change a person's sexuality, including the South African Defence Force. It should be noted that for a while, homosexuality appeared to have been, if not tolerated, then allowed to exist within the military. In many cases, homosexual soldiers were segregated to form their own battalions, though there was little in the way of progression or opportunities to rise the ranks. The official position was that homosexuality was a subversive movement that had no place in the military. The Aversion Project, which sought to remedy the situation, was led by Dr. Aubrey Levin, who obtained his education through a military scholarship. Even before he had obtained his license as a psychiatrist, he showed himself as interested in curing homosexuals. In 1968, he wrote to the Select Committee on the Immorality Amendment Act, set up by the South African Parliament, eager to present his work in using electric shock treatment for homosexuality. Upon joining the South African Defence Force, Levin was given the rank of colonel on account of his status as a licensed psychologist. In 1971, he led the military's drug rehabilitation program. It is here that he came into contact with conscripts who were considered deviant, usually for drug use, those who didn't want to serve in the military, or those who were homosexual. Once identified, the conscripts would be sent to Levin's facility, where they would be subjected to torturous and crude treatments. They would be stripped of their clothes and made to wear a brown uniform. The patients were kept on a steady supply of Valium, whilst the orderlies carried guns, all to prevent escapees. The aversion therapy would involve attaching electrodes to the arms of the patients, linked to a machine calibrated to deliver electric shocks at various strengths. Then, the gay soldiers were shown pictures of a naked man and told to fantasize about them. Then, the electric shocks were administered in ever-increasing voltages until the patient could not take any more. At this point, a picture of a naked woman would be shown, and again they would be told to fantasize about them, as a means to encourage heterosexual arousal. The same would be done for lesbians, but of course the images would be the opposite. As you might imagine, such procedures did not produce the desired results. Nevertheless, Dr. Levin was able to rise up the ranks and become the chief psychologist of the entire South African military. When the aversion therapy failed to convert a person's sexuality, chemical castration started to be used as a means to switch off the homosexual impulse, though this only led to more suffering. As you might imagine, the impact of such abhorrent treatment was catastrophic. One tragic example is that of Jean Erasmus. In 1980, he was subjected to chemical castration by Dr. Levin, but this was not the end of the homophobic treatment he endured. He was made to commit gang essay against Angolan women by his officers, and he was subject to all manner of abuse by his comrades. The details of the events were described in an audio recording left by Jean shortly before he took his own life. Just one example of the impact the Aversion Project had upon its victims. In the face of the failure to convert homosexuals, Dr. Levin oversaw a drastic change in policy. A large number of homosexual people were subjected to gender reassignment surgery. The rationale for these surgeries was based on a crude belief that to be gay was to mean you were born of the opposite sex. It was pushed that surgery would end their preferences for the same sex by allowing them to fulfill their projected role in the opposite sex. It is thought that as many as 50 people a year underwent such surgeries. Often, the surgery was not completed, one example being of a gay man who was given breasts, and this was the extent of the intervention. There was no follow-up treatment, nor any hormone treatments which would be considered normal practice now for such surgeries. Some would even die on the operating table. It is thought that some used this policy to obtain the surgery they desired, though in most cases, the soldiers were pressured into the surgery that they did not want nor need, and, without informed consent being obtained. Once discharged, the victims were told to cut off all ties with their families and friends, and were given new identities and new birth certificates, and were told to start a new life somewhere else. Whilst you might think that such practices are a thing of the past, a 2016 survey of the European Union Agency for Fundamental Rights would indicate otherwise. It was found in such countries as Bulgaria, Hungary, Italy, Latvia, Poland, Romania, and Slovakia. Plenty of medical professionals from these countries believe that homosexuality is a mental illness, a direct conflict with the Council of European Recommendations of 2010. This recommends that homosexuality not be treated as something that needs to be cured. Nevertheless, conversion camps or therapies which aim to fix a person's sexuality still exist, though there are efforts in some countries to ban such practices. As for Dr. Levin, he was called out by the Truth and Reconciliation Commission, which sought to look at the crimes of the apartheid state. In a report published in 1999, it listed his crimes, stating that he engaged in widespread torture, although the report didn't list him by his name, and only referred to him as the Colonel. At this point, Levin had fled to Canada, where he continued his work in psychiatry. He also worked in a teaching hospital in Alberta, despite there being many publications listing his crimes, including an exposé by the Guardian newspaper. It was not until March of 2010 that Dr. Levin was suspended for different reasons. He was accused by over 30 men of SA. All of these men were under his care. He was filmed secretly by one of his patients, making inappropriate advances as well as unwanted touching. 9 of the cases were brought to trial, where he was convicted of SA. This was despite his wife's best effort to bribe some of the jurors, for which he was convicted for obstruction of justice. Levin has always denied any wrongdoing, both for what he did in South Africa and insisting he was the victim in the Canadian case. In an interview, he insisted with The Guardian that the people under his care volunteered to the Aversion Project, and that there was no sexual motive to what he did to his patients in Canada. The Aversion Project in South Africa is one but many of the crimes of the apartheid state, and perhaps one that does not immediately come to mind. It is a grim reminder of just what homosexual people have endured throughout much of history. Whilst much has improved in many countries, recent news would show that it is not everywhere that homosexuality is accepted. The Aversion Project highlights the lengths that some are willing to go to cull homosexuality from society, and the damage that such efforts inflicted on so many. It shows the grim hypocrisy of a doctor who seemed obsessed with curing in others what perhaps he detested in himself. It shows a state more than happy to engage with such barbaric treatment of its people, so long as it produced soldiers deemed acceptable to uphold its racist system. But above all, we must not forget the young victims of this crime, the vast majority being young men barely in their 20s, many of whom ended up taking their own lives as a result of the horrific treatment they endured.